Hi, so I'm Natasha Tyler, and this poster presentation is going to talk today about the co-design and implementation of an intervention to facilitate patient information sharing upon admission to an acute mental health ward. This work is funded by the NIHR Greater Manchester Patient Safety Translational Research Centre within the University of Manchester. So many interventions have been developed that aim to improve the transitions from ward to community at the time of discharge, and these have had varying success. But guidelines suggest that discharge planning should begin from admission, and in reality this is an ideal rather than standard practice. This research aims to develop a novel intervention that improves mental health care transitions by providing a framework for capturing relevant information at admission that facilitates and accelerates discharge. This was a formative implementation study to co-design, implement and evaluate a novel tool that improves information capture upon admission to acute mental health wards within a single NHS trust. We used 2 cycles of Plan Do Study Act, PDSA, which included 2 workshops that were based on the principles of co-design. During implementation, the tool was piloted on 3 wards, and the evaluation involved observation of conversations that happened with external agencies upon admission, within 145 hours of ethnographic style research. 45 interviews were conducted with 40 staff across the campus. The consolidated framework for implementation research was used to analyse and categorise the qualitative data generated. So the results. The tool developed considerably as the process evolved. The finished product is a list of 10 relevant information categories that should be captured from external agencies upon admission to facilitate discharge planning. The most reported relative advantages of the tools were firstly, facilitating confidence in more junior staff, for example, to legitimately question the suitability of a patient for an acute ward. Secondly, collecting and storing essential information in a single accessible place that can be used throughout the care pathway. And finally, collecting information from the social services or agencies in the community that patients might eventually be discharged to. The consolidated framework analysis highlighted multiple barriers to implementation from both an outer and inner setting perspective. And if you want to know more about this, either contact me or you can see it in the final paper when it's published. So in conclusion, the results suggest that improving the quality of information captured at admission has the potential to facilitate and accelerate discharge. This novel tool provides a framework for capturing this information that can be incorporated into existing information systems. Thank you for listening. If you have any questions or comments on the presentation, please add them below and we'll read and respond. Thank you.